Welcome to Medical Experts in Football. I'm Tawa Deshivan, your host, and I have to say, today may be uncomfortable for many because we're going to be talking about uncomfortable topics like sexual abuse. But these are the conversations that need to happen because in reality, we all can be part of the solution, whether we know it or not. So today's guest is another sports psychologist in the San Francisco Bay Area with over 30 years of experience working with professional and amateur athletes. But her specialty focuses on female teens and adults, as she's written 2 books about women's fight for equal pay and sisterhood in sports. You can check it out on Amazon. Joan Steidinger is her name.
You played a number of sports before Title IX came into existence. And it seems that is how you became interested in sports psychology. Is that correct?
Yeah, I'm a lifetime athlete.
Well, how did sports translate to you studying psychology?
I was always interested in the mental part of sports because one of the things that happened to me in high school was I had probably the worst coach I've ever had in my life. And she yelled and screamed, my tennis coach, and I got worse. And a polar opposite to my badminton coach, who was positive and encouraging and all those things. So at 19, I knew I wanted to be a psychologist and help other people. And I had a love of sports because, I started sports when I was like 3 and 4 years old, which in my age group is kind of unusual, but I had 2 athletic parents. So that made a huge difference. It just so happened that when I came to the Bay Area for my Ph.D, I did my first internship at Cal State, which was called Cal State Hayward then. And there was a woman there who was a sports psychologist besides being a clinical psychologist. And she was working with swimmers and synchronized swimmers and runners. So she kind of took me under her wings for a year in that internship. And then I was really interested in doing sports psychology. So my next 2 internships I did were all about I did one in biofeedback for a year long in a school that was analytic. So I was always kind of going against the grain. And then I did cognitive behavioral internship for a year.
Yeah.
Back when it wasn't really as well known as it is now.
Yeah. Well, you talked about your first coach being such a yeller. That whole experience that you faced during tennis as a youth, did that impact you as you got older and even while you're studying psychology? Or do you feel like you were able to look past that?
At the time, no, I internalized all of it. And it was always what I was doing wrong. And so I could shift in badminton because the coach was so different. And I was number 2 on the team. And I was actually quite much better at that, I think, than tennis. But I do think I internalized a lot. I was the kind of person that was always trying to help the underdog.
Well, of all the areas you studied, I saw executive coaching, sports psychology, performance issues, injured athletes. We could go on and on. Of all the areas you've studied so far, which topic has been the most challenging for you personally?
Well, I haven't done anything with, that's not even true. I actually was involved in a program with Special Olympians where we took them when I was on a bike club and we took them on tandems. The problem with me, to be honest with you, Tyler, is that not that I need to find interest. I've always been the kind of person who has to narrow my interest because everything interests me about sport.
Yeah.
With the sexual abuse stuff coming up, I have been treating women with sexual abuse issues since the early 80s anyhow.
Well, you said you've been working with females and the whole abuse topic. For clinicians that may have athletes that come to our clinic, are there some signs or strategies a clinician can do to pay attention to maybe if an athlete may be experiencing this? Because I think that an athlete may meet so many people along the way while they're going through this very painful and traumatizing experience. And if there's a way that medical providers can be part of the solution, what do you think could help?
Well, I think, someone who's withdrawing, someone who's not socializing and had been previously and isolating, someone who's always got good grades, but now the grades are for college students, the grades are declining, someone who isn't real happy with their coach and kind of asking them, well, kind of what's going on. I did an assessment for a friend years ago on his cross country daughter in college, who's in a small college here. Says, I'm worried because I think she has an eating disorder. So to just slide over to that for a second, sorry. Mm-hmm. But I did this assessment on her and she did it. She was anorexic. And I said, well, she goes, well, all the girls are on our team. And I said, well, maybe, I'll tell your coach, I'll come in and talk. She's like, oh no, the coach wants it that way. He doesn't want us to eat. He doesn't want us to be healthy. And it just was a mind blower to me. But I think the sexual abuse stuff, the trouble with detecting it is a lot of these perpetrators make these young women feel like they're special, and they groom them to think they're special and to keep it secret.
Yeah.
If there's any kind of odd behavior, unusual behavior for an athlete you might be treating, I would check around a little more.
Yeah. And you talked about kind of some of those things we can observe as a clinician, but you also mentioned about how if they're unhappy with their coach. So would you recommend clinicians just, besides asking, how's your sport going? Or just asking, how's your relationship with your coaches going? Do you think that's a fair question to ask?
Sure, absolutely.
Yeah. And for I'm sorry, go ahead.
Go ahead. I was just going to say, and how's the teamwork going? I might ask that too. Because one of the things when there's an abusive coach, a sexually abusive coach, is there won't be as much camaraderie necessarily amongst the girls. It'll be a team that is a little more, I think, disjointed and not as close as you'd like a team to be effective. So you have to pay attention to that as well. Yeah. And I think the big thing, though, Taiwo, is that it's building. The most important thing, I think, is when you build trust with the athletes. This is what I've found. At some point, because it's so much in the media now, they're more likely to come out with it because they can trust you.
But I imagine, though, that there are some athletes where it's pretty tough to break through them. What strategies have you implemented yourself?
Well, one of the things that I do is I let people be themselves, and I feel them out for kind of how much I can push them or not. And so my strategy is to kind of push and see what can they hear from me direct, and what kind of questions might make sense to them. And also, I really try to check in a lot about their team and their coaches and how they're being treated. And, there was a situation in San Jose State where we just lost an AD because she wasn't paying attention to the fact that somebody had been complained about numerous times. And she was more concerned. I hear from some of the female athletes that she was more concerned about the football team than really looking at the whole broad spectrum of sports that they have at San Jose State.
And that's so interesting you say that, because even among the professional leagues, it's not like the complaints weren't sent by email or communicating. Why is this something that still gets overlooked?
Well, it's actually against the law. Now, in many states, you're a primary reporter if you're working with kids, period. So if you hear something firsthand, you're required to report it. But I think there's been a lot of secrecy and denial in the old boys network. I think they're partially to blame, to be very direct, particularly the old white boys network. And they've covered, I mean, the Nasser case was a perfect example of how his behavior had been covered up for decades. Even when the head of USA Gymnastics was interviewed, he's like, well, of course, I didn't report it to the police. Of course not. And it's like,
You have a
you
responsibility
have a
to, yeah.
responsibility and you have a legal responsibility too.
Mhm. For medical providers that suspect this, sure, they have a responsibility to report it, but how can they break this news to, say it's a youth's parents that has no idea? Do you recommend them to talk to the parent and just tell them,
Oh,
hey, this is what I'm seeing?
Before there's any report, I talk to the young person, the high school kid, and bring their parents in and work on explaining the situation. And usually I find most parents are very open to hearing it. Sometimes the teenage girl or guy is a little hesitant, but we try to practice ahead of time prior to their parents coming in, unless it's something horribly acute. And then I just have to report it and call the parents right away.
Mhm. What does it look like sitting them down, the parents and the players, to open up that conversation? What's that like?
Tense
Yeah.
and highly uncomfortable. But I when I work, I'm very soft spoken and try to be really gentle in my words. You know, a lot of people don't really watch their words near enough to be kind in terms of how they address things about, you know, this could, when we're about to talk about, could be really uncomfortable. I'll just prescribe how it's going to be uncomfortable and hard to discuss. And it's very important that you understand where things are. And then I would have the athlete tell their parents what they're comfortable with.
Mhm.
And then explain that this is the kind of thing that needs to be reported.
Okay.
And it's not easy at
Yeah,
all.
I can imagine.
Yeah, some parents just don't want to deal with it, and it's like, well, legally by law, I have to.
Yeah. And legally for medical providers, we also have the responsibility to do so as well. Yeah.
Absolutely.
Well, I know that aside from abuse in general, you also have worked with injured athletes. And
Mhm.
I'm curious about your thoughts because we, as medical providers, as a physical therapist, I often
Mhm.
have athletes coming to my office that are injured, that are trying to return to their sport. But a lot of times, athletes go through a psychological component, whether that's returning to their sport or trusting that they can uh,
Mhm.
actually be active again. I'm just curious, what are some of the most common concerns that injured athletes may come to your office and share when it comes to getting back to the sport that they did for so long?
Well, a lot of them then don't consider themselves athletes. And I reframe it for them and say, you're just an injured athlete. You're still an athlete. And we have to look at whatever your injury is, whatever the injury is, and how long it's going to take. Or I've had a physical therapist refer to me who had a guy who was doing a lot of long distance running, got a really bad injury. It was Achilles. And he was moving along really well, but he was convinced that they weren't doing enough and then he was not going to get back to running. So she sent him to me because of part of the reason she sent him to me is because I'd been an ultra runner and told him that I'm going to be a good person to talk to about it. And we talked about it and we talked about his progress and where he was. And all I did really was reassure him that he'll get back to running. But if he tries to push it too hard, he'll go backwards. And he says, you know, thank you so much. So I gave him a reality check, really.
And he kind of took it all in, and
Yep.
did
But
he?
not everybody does. I had
Yeah.
a female rugby player who was trying to make the national team. So she was a high level player. She had a knee injury and I knew her physician and she was doing her rehab, coming talking to me about rugby pretty much a good part of every session. And her physician said, don't go back, be careful. And I said, we should listen to him. And she didn't. And she went back and she injured herself right out of rugby. But what we did is we turned that around into, well, how can you be involved in rugby since you love it so much? And so her plan was to work more with her team, help give tips to gals that were new, and kind of be a coach on the sidelines, and probably ended up being a coach. And then I had another gal who had been at the Olympic Training Center and had a back injury. And so she was having trouble really riding at the level she had before. And the word was, this was a career-ending injury. And she'd been for a long time at the training center. So I would try to say, okay, how are we going to shift things here? Because you're not going to be riding at the level you were. Well, she'd get around her friends periodically. She did this twice in my treatment of her, and go out and ride way too hard and re-hurt her back. And then I'd say, you still want to ride, right? Yeah. I said, so you can't ride like you used to ride. And she'd be okay with it for a while. Mm-hmm. And then she'd do the same thing all over again, until it took probably 8 months for her to to accept that she wasn't going to be riding at that level anymore.
And you mentioned that some athletes need to be reminded that they are an athlete. Why, I guess, when I have an athlete that comes into my office, this may not be something they express to me, but why do you think athletes experience that loss?
Well, it's if they base their whole life around that sport, to not be participating in the sport, to not be able to participate means they got to redefine their life. And so it can become a very big trauma for them unless they can reframe it. It's kind of like if you look at the pro players, when they retire, they're not doing a lot of work to help these guys transition. And it all at some point comes to an end. And, with girls in a lot of sports, the end is college.
Yeah, because I just asked that because I know as a young athlete, I faced a number of injuries, but knowing that I would be back playing, that helped reassured me. But it seems like for some athletes, their definition of who they are may be so wrapped around their sport that it's really hard to think of anything else. Well, when medical providers have these athletes that are experiencing this, what strategies can we use in the clinic to make them feel like they are an athlete, whether it's talking about the sport or introducing a football into a treatment? What would you recommend?
Well, I think, like you said, it's acknowledging they are an athlete and allowing them to talk about their sports and what they loved about it, what was really worked for them and where they had problem areas. So, that you're understanding your sport. Because one of the things that I do every time I've gotten a new athlete from a different sport is I go immediately on the internet and really educate myself a lot about their sport so I can understand their language, because I think that's essential.
Yeah, absolutely.
And that's what's helped me work with a variety of sports over the years. It's allowing them to talk about their sport. It's encouraging them to stick in there, even though it seems hopeless at times in terms of getting better. But the important thing is to persist and persevere and be determined. And hard work comes into rehab. Mm-hmm. And if it looks like they're going to go backwards, I just say, got to get back to rehab, get back to consistency here. And then if they come up against the fact they're not going to do their sport, how can you stay involved? What would you like to do? What could make you feel a part of things? Because we know the sport means so much to you. So I have them do some problem solving around their future if it's not going to involve the participation they've had in the past.
And aside from the injured athletes, I think in general, it's good for athletes to have not so much of a narrow view of like sport, like have other things. So, for athletes that may not be injured, what are some things that even as medical providers that we could try to help instill, even if it's just that 45 minutes we see them in the clinic, to help them even after their sport realize that they are someone still important and can contribute to society in so many different ways?
Well, one of the things is to start seeing what has meaning to them and interest, because some athletes think they have no interest and have no meaning except sport, but we all need some kind of meaning in our lives. And when we go from being really a good athlete to back of the pack, it's a big adjustment, but it's kind of part of getting older and getting injured. But the fact that they're still doing it is really important. But it's trying to get them to think more beyond sport in terms of other interests. Some people say, I have none. It's like, well, what did you do before sport? What kind of interest did you have as a kid? What kind of things have you been curious about that you haven't ever acted on? So I'm trying to get them to think broader, because one of the things, as you know, with that depression that can so often go with injured athletes, world narrows. And so I try to do these steps to broaden their world so that they're looking at a variety of things as opposed to just, I can't do the sport.
And how long can that take for an athlete to
could
really
take a very long time.
When you say long, are we talking years?
Yes.
Yeah.
I have a kid right now who's a rugby player and was a really good one, but he had a lot of mental health issues. And he hasn't played rugby for a year because he's been injured. And then he went out and played probably too hard recently. And now he's having issues again. And it's like trying to ease him back in. But there are other areas of his life, like he used to have huge anger issues. And he does, but they've shrank. And he's actually handling things so differently, even than like 6 months ago. Yeah. And see, he's been with me and then not with me and with me and not with me. And
on and off, kind of.
On and off, yeah. And he's been a kid since he's half Chinese and half white, who had a lot of discrimination directed him. So, it's trying to get him to have discussions with differences with people. And he actually had one the other day at college with another kid who was really he said that my client was being racist because he made some comment about white men. And it's like, wait a minute. You don't know what race is. So he had a discussion with this guy, and this guy calmed down and he calmed down and nobody got hurt. And he couldn't have done that 6 months ago.
So it does sound like that we as people need to come to understand that some of these things can take time, and maybe it's a conversation that you need to have with the athlete and let them, like you said, it reassure them and be persistent, but also be realistic that this is not a thing that just turns around in a day or two. You might still have your ups and downs.
Yep.
Well, I know you briefly talked about depression, especially for injured athletes. I know when I was an athlete who was injured probably every season, every sport, because I played 4 sports in middle school, high school. So at times I certainly had those moments where I was very lonely, very sad. Besides sadness, depression, what are some limiting factors that you have seen in athletes that have recovered from their injury, but they're still struggling to perform at the level that they were at before their injury?
Well, depression is one thing, but the anxiety is a huge issue they struggle with, because sometimes they expect themselves to come right back in where they were before. Mm-hmm. And with anxiety, it's really this issue of having to learn to manage the anxiety better. And like one girl I worked with, who was a swimmer, had terrible anxiety before meets. Well, she got around all the people and she had anxiety issues anyhow. So then the anxiety would escalate. So what she started doing was staying away from the group just before her event and then participating, and her anxiety went way down in the process. Because I do think depression and anxiety are two of the big issues. And also, one of the issues for women in particular that's huge is confidence. I think confidence for female athletes is much harder to come by than with men. And because we're much more self-conscious, we're quick to judge ourselves about how we look, and the world does the same thing to us, which is not helpful.
Yeah. On the note of anxiety, what strategies do you tell your athletes to help them get through that?
Well, like I said, with this one girl, I had to remove themselves. I also am working with a young gymnast right now who we've started doing breathing in the morning. It's so funny because, I'm so old school. I just think you can learn breathing. And she is, she started with like a 3 minutes and now she's up to 7 minutes. No, she got up to 7 minutes and now she's at 10 minutes and has noticed her anxiety declining. She also uses some power words for herself.
What's that?
Like strong core. That's her mantra to herself that seemed to be helping. Reminding oneself that they have, like some people, like in running races, they start out with their shoulders very tense. And so one of the tricks that I use is have them focus their attention on their shoulders when they start, particularly in long distance events, not so much of the short distance, but relaxing the shoulders, like for the first 5 or 10 minutes. And for long distance people, even up to 20 minutes. Mm-hmm. So that they relax, they look at the part of the body they're uncomfortable with and try to make it really relax and think of it as strong. Up to 80% of women in this country, all women, have discomfort with some part of their body, which is not true for men.
Why is that?
If you look at the media, Taiwo, what does the media do to women? They sexualize them.
Yeah.
They comment on their body and how they look and on their family and their kids. They don't do that to men. They don't even care about that. And they shouldn't care about it with women.
And, I think in this day and age, now that I've been involved in sports journalism, sometimes I can be watching a video about a female journalist providing insights about a player. And in the comments, it's flooded with things about her appearance that have nothing to do with what she's even talking about, which can be quite disturbing. But I think the reality is that that's probably not going anywhere anytime soon, as long as humans are on this earth.
Well, I'd like to see it reduced. Let me tell you, when Cam Newton, I don't know if you remember this instance, Cam Newton was with Atlanta, and there was a female journalist questioning him about his roots. He started laughing at her, and everyone was like, "What's up with that?" And he goes, "Well, it just sounded funny from a woman asking me about my roots." And I mean, dead silence.
Yeah.
And he never apologized to her. And her comment was, "I didn't think it was funny. This is my job. I take it quite serious." So those kinds of things don't really help.
Do you think we as people, whether that's us working a general 8 to 5 job, we're not in these higher up positions, how do you think we can be a part of this systemic issue that you said it's really still kind of under the covers for a lot of organizations? How can
I do see, one of the things I do see that's happening is there is more training going on about sexual abuse and sexual harassment. And so we need to ramp up training, for one thing. We need to not be afraid of hard subjects. because I teach in my class, I teach hard subjects. I teach about the Me Too movement and sexual abuse in the general sports psychology class. And it's really interesting because the girls participate in that discussion way more than the guys.
Really?
Yeah. And the substance abuse discussion was the hardest of all.
How come?
Because people don't want to talk about it.
I see.
They don't want to, and the thing is to go in recovery from using drugs and alcohol is so courageous. And yet we look at people like that askance still, as opposed to appreciate all the work they've had to do to get there and move ahead and reshape their lives, because people who really stop that have to have a lifestyle change that doesn't include drugs and alcohol. And it is, I used to have an illusion that athletes didn't have drug and alcohol problems.
What an illusion. That's a big one.
And then I trained for my first marathon, and the training group I was with, people knew I taught at the Alcohol and Drug Studies program at UC Berkeley. And they would come up to me and just, chugging beers, and I'm like, whatever.
Whatever. Yeah. Well, I'm curious because at the end of the day, we all, like you mentioned, we're all people. And we all are people that have something to say and also want to be heard and understood.
Sure.
What is the best advice that you've been given that you would give anyone when it comes to relating to people and really trying to put themselves in another person's shoe?
Practice empathy, compassion for the suffering. Empathy is huge, but I think this big thing is to realize that a lot of people are suffering, particularly angry people. Nobody, the people who go through their life angry just have no happiness. And practicing kindness. One of the things that went away with our last administration was kindness, and meanness became the norm. And I think we need to really be kind on a daily basis to our fellow humanity. Be kind to students, be kind to your students, be kind to your fellow workers. And if they do crazy things, realize it's them and not you. And the best we can do is just try to step back and have some compassion.
I like that. Kindness, compassion, empathy, all great stuff. If we all were more like that, this would be such a happier world for sure.
Yeah. Well, I have a little saying that I made a motto for 2021. It's on my signature. It says, keep kind in mind. And it doesn't take a lot of effort to be kind. It takes way more effort to be mean and angry.
Absolutely. Well, I am so grateful for all of your insights and really thought that you provided some helpful strategies for really medical professionals when they're interacting, whether it's injured athletes, youth, specifically female athletes, and really just finding ways as people we can best relate and help really understand where someone else is coming from. So thank you so much for your time.
Well,
and you are in San Francisco, so maybe one of these days I can just walk into one of your classrooms and sit in for one. What do you think?
Oh, absolutely.